10 Down WJ presents Empower Yourself to Make Positive Choices for Your Sexual Health and Advocate for a Culture of Safety, Respect, and Understanding in Your Community. 1. Introduction. Sexual health is an integral aspect of overall well-being. It encompasses not only the absence of disease but also a positive approach to sexual relationships and practices. Empowering oneself to make informed and respectful choices in this area is essential. Moreover, advocating for a community culture characterized by safety, respect, and understanding fosters healthier relationships and attitudes toward sexual health. Journey with me as we will explore various dimensions of sexual health empowerment, emphasize its significance, and discuss the collective responsibility of individuals within communities to nurture a supportive environment. 2. Understanding sexual health. Sexual health is a complex concept that includes physical, emotional, mental, and social dimensions related to sexuality. The World Health Organization defines sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. It recognizes that it is not merely the absence of disease or dysfunction. Engaging with this holistic understanding creates the foundation for positive choices regarding sexual health. To foster a culture of safety and respect, we must first acknowledge key areas of focus. These areas include education, consent, access to healthcare services, and the eradication of stigma around discussing sexual health. Each of these aspects plays a vital role in not only personal empowerment but also in advocating for community awareness and informed practices. 3. Education as a foundation. Education about sexual health equips individuals with vital knowledge and skills. Comprehensive sex education programs provide information on anatomy, reproduction, consent, and disease prevention. Studies have shown that when individuals are educated about their bodies and sexual health, they are more likely to make informed choices that prioritize their well-being and that of their partners. Around the world, there are significant variations in the quality and accessibility of sexual health education. In regions where comprehensive programs are available, improved sexual health outcomes are often observed. This includes lower rates of sexually transmitted infections and unintended pregnancies. In contrast, where education is limited or abstinence-only programs are enforced, misinformation and unhealthy sexual behaviors can proliferate. Promoting consent is just as crucial as education. Understanding consent requires an emphasis on communication and mutual respect. Individuals should feel empowered to express their needs and desires while also respecting their partner's boundaries. Consent is not merely a legal requirement, it is a fundamental aspect of healthy and respectful sexual relationships. Advocating for educational programs that thoroughly address the concept of consent will foster a positive shift in communal attitudes towards sexual health. 4. Access to healthcare services. Access to healthcare is another critical element of sexual health. Individuals must have available options for routine checkups, screenings, contraception, and sexual health education. However, disparities in access can significantly affect one's ability to make informed decisions. In many communities, individuals face barriers such as lack of transportation, financial constraints, or a lack of culturally competent care. Advocating for accessible healthcare services demands collective action. Communities should work towards implementing outreach programs that offer sexual health services in schools, community centers, and other local venues. These services should be confidential, affordable, and tailored to meet the diverse needs of various populations. Recent years have marked significant strides in telehealth services, which have increased accessibility for many. By leveraging technology, healthcare providers can reach individuals in underserved communities and provide education and resources on sexual health remotely. This innovation presents an opportunity to bridge gaps and advocate for equitable health services. 5. Eliminating stigma and encouraging open conversations. Stigma around sexual health can create barriers to seeking help and accessing resources. Conversations surrounding sexual health often elicit discomfort, leading to silence around vital topics. This stigma perpetuates misinformation, as individuals may rely on anecdotal evidence rather than factual knowledge. Removing the stigma associated with discussing sexual health is crucial for nurturing a sense of safety and support in communities. Influential individuals and organizations have played pivotal roles in normalizing conversations surrounding sexual health. Activists and educators such as Planned Parenthood, the Trevor Project, and FPA have been at the forefront of advocating for sexual health rights and education. These organizations have worked diligently to combat stigma through public awareness campaigns and grassroots activism, showcasing that discussions about sexual health can be informed and enriching. Community advocates can facilitate forums, workshops, and outreach initiatives that aim to encourage dialogue on sexual health topics. This can demystify the subject and create an atmosphere of mutual support and learning. An informed dialogue will not only educate but can also empower individuals to take charge of their sexual health and advocate for their rights. 6. Building a culture of safety, respect, and understanding. A committed culture of safety, respect, and understanding requires participation from all community members. Individuals must empower themselves to take ownership of their choices and communicate their needs effectively. This includes establishing clear boundaries and being open to conversations about desires and concerns with partners. Cultivating community support networks can foster a sense of belonging. These networks can consist of trusting relationships where individuals feel comfortable discussing their sexual health and sharing experiences. For instance, peer-led groups can provide support and resources for navigating sexual health challenges collaboratively. In the wake of recent advancements in technology, social media platforms can serve as powerful tools for advocacy. Awareness campaigns can utilize these platforms to spread messages about sexual health empowerment, education, and the importance of consent. Harnessing the reach of social media can engage younger audiences and inspire them to participate actively in advocating for their sexual health. 7. Future perspectives. Looking ahead, the landscape of sexual health empowerment is likely to evolve continually. Increasingly, educators, advocates, and healthcare professionals recognize the necessity of inclusive practices that cater to diverse populations. By prioritizing intersectionality and incorporating the experiences of marginalized communities, we can empower individuals from all backgrounds to embrace their sexual health without fear of discrimination. Furthermore, the emergence of technology in sexual health education and resources will remain vital. Virtual platforms and applications devised for sexual health management have been steadily rising, providing individuals with crucial information at their fingertips. These innovations can further alleviate barriers to access while promoting safe sexual practices. All stakeholders must prioritize ongoing advocacy to address the persisting gaps in sexual health education and services. Policymakers, educators, healthcare providers, and community members must collaborate to develop frameworks that support open conversations, equitable health access, and comprehensive education. In conclusion, empowering oneself to make positive choices for sexual health is a multifaceted endeavor that requires personal commitment and collective advocacy. By prioritizing education, promoting consent, enhancing access to healthcare services, and eliminating stigma, individuals can take meaningful steps toward nurturing a culture of safety, respect, and understanding in their communities. As we look to the future, fostering an openness and willingness to engage with these topics will be crucial for the continued advancement of sexual health empowerment. Together, we can create an inclusive environment where individuals feel supported in making informed choices that enhance their overall well-being. 10 Down WJ, where creativity meets impact.